Today we are going to look at the variance. The variance in the congenital adrenal hyperplasia. So to begin with questions, the first question is, talk about the variant that is 21 hydroxylase deficiency. The second question will be, talk about the 11 beta hydroxylase deficiency. So we'll find out these answers in this video and learn a lot more. To begin with, the 21 hydroxylase deficiency. So this is nothing but the deficiency of the cortisol and the aldosterone. And there is increase in the testosterone. There is a salt wasting crisis also seen. Salt wasting crisis. There is virilization of the females. So this means the presence of the ambiguous genitalia. Ambiguous. It means there is ambiguous genitalia. That is 46XX. Then what we see is there is precocious puberty in males. Precocious puberty. And this precocious puberty is seen in the males. So then we move on to the 17 hydroxylase deficiency. 17 hydroxylase deficiency. So under the 17 hydroxylase deficiency, it is nothing but the deficiency of the cortisol and also the sex hormones. Then what we need to know is there is an increase in the aldosterone. So in 21 hydroxylase it was the testosterone, and 17 it is the aldosterone. And here there is the salt retention as well. So there is also the salt retention and also the hypertension. There is a failure of the sexual development in females. So failure of the sexual development in the females, and this occurs at the puberty. So next there is also that the males are incompletely virilized. The males, they are incompletely virilized. So that means they have a ambiguous genitalia. So it is ambiguous genitalia, and this is nothing but 46XY. Next we move on to the 11 beta hydroxylase deficiency. So what is this 11 beta hydroxylase deficiency? Hydroxylase deficiency. So here it is nothing but the deficiency of the cortisol, and there is increase in the deoxycorticosterone. Increase in the deoxycorticosterone. That is nothing but the mineralocorticoid and also the testosterone. Next, there is the salt retention. There is salt retention as well as this presence of the hypertension. There is virilization, and this is of the females. That is the presence of the ambiguous genitalia. The ambiguous genitalia. This is nothing but the 46XX. Next, there is the precocious puberty in males. The precocious puberty. This is seen in case of the males. Now we will look at the 3 beta HSD deficiency. So here 3 beta HSD deficiency. So this is nothing but the deficiency of the cortisol. Then there is also the aldosterone. Then there is also the presence of the testosterone. So here there is nothing but there is increase in the DHEA. There is increase in the DHEA. There is also presence of the salt water wasting crisis. So there is salt wasting crisis. Then we need to know that the females are mildly virilized. So the females, if you see, they are mildly virilized. So the DHA here, the DHEA is a weak androgen. Weak androgen. Other thing to note is that the males are incompletely virilized. So it is similar to that of the 7-hydroxylase deficiency. So here also the males are incompletely virilized. That is nothing but the presence of the ambiguous genitalia. That is a 46XY. Now we'll move on to answering our questions. The first question we asked was, what is the 21 hydroxylase deficiency? So we'll be answering that. So it is nothing but the deficiency of the cortisol. So deficiency of the cortisol and the androgen. The second is it is increase of the testosterone, and there is the salt water crisis, salt wasting crisis. Next comes the virilization. There is also the virilization. So this virilization is of the females. So this means that there is the ambiguous genitalia, and this is nothing but the 46XX. Then there's a precocious puberty. So this precocious puberty is present in nothing but the males. So this is about the 21 hydroxylase deficiency. Next we move on to the 11 beta hydroxylase deficiency. This was the second question we asked. So what is a 11 beta hydroxylase deficiency? So to answer this, firstly it is the deficiency of the cortisol. So deficiency of the cortisol only. And here there is increase in the deoxycorticosterone. The increase in the deoxycorticosterone, it is nothing but the mineralocorticoid, as well as the testosterone. Then there is also the presence of the salt retention. There is a salt retention, and there is also presence of the hypertension. Here there is the virilization of the females. So this is nothing but the presence of the ambiguous genitalia, and that is the 46XX. Then comes the precocious puberty. So there is also precocious puberty, and this is nothing but in the males. Next we'll be moving on to some bonus questions, so you can answer these questions in the comments. So the first question we want to ask is, what is the 17 hydroxylase deficiency about? What is a 17 hydroxylase deficiency? What is it about? And the second question will be the 3 beta HSD deficiency. What is it about?